Yes.
Okay, thank you. So we will wait for 2 minutes and then we will start. Right, so we will start now. My name is Amir. I'm the hematology registrar in Leeds, UK, and I frequently do the FRCPath Part 1 and Part 2 sessions on every weekend, Saturday for Part 1 and Sunday for Part 2. We had already done session for Part 1, how to plan for Part 1 and how to prepare. It has been recorded and uploaded to our website, which you can see here. Many new people have joined afterwards, so we thought we should keep a small session for them as well. And there are a lot of questions by the overseas candidates regarding FRCPath exam, especially about eligibility criteria, how to apply for the exam, when are the dates usually open, and what is the criteria, especially about whether we should do FRC, MRCP or the lab before the exam. Or yeah. So FRCPath Part 1 exam is twice a year. It usually happens in the last week of March and last week of September every year. Both Part 1 exam are in the last week of the month of March and the September. Part 1 exam is online exam. You can attempt this exam from your home, from your office, and from the hotel or from your comfort zone. You do not need to come to UK to uh, attempt this exam. The application process is online. If accepted, you can attempt this exam from your home. But this is online exam. You do not need to go to any prometric centers or paper form of the exam. You can um, attempt this exam via computer which has a cam because your camera will be open all the time during the exam. No age limit. Okay? If you are uh, about 25 or if you are 90, you can go for the exam. There is no age defined in the RCPath website. Okay, many professors from overseas they have appeared in the last part one exam and they part one exam before that with me. They prepared their part one exam with me, and they were professors in Gulf countries. Prepare your part one exam with our website, with our group, WhatsApp group, with our channel. We will discuss about the preparation of exam later. And join our WhatsApp group. We usually discuss our post our MCQs over there, post the updates, people ask questions, scenarios, and this will keep you updated. Then you will not be attempting any question with old material. You can attempt the essays or MCQs with new updates. Because I have this experience now by checking the paper of multiple candidates, especially, for example, sickle cell. When you ask them how would you treat that, they still include cresenlizumab, which has been removed from the UK guideline. They still mention that we will give them red cells 10 days old or the top of 7 days old for the saying these age limit has been removed from the sickle cell, the top of transfusions, um, or the red cell exchange things. These things has been updated. You need to be aware about the new updates. So be part of our WhatsApp group or Facebook group um, or the in the X or in the LinkedIn, wherever you prefer. We are present everywhere. For overseas candidates, they usually ask us, do I need MRCP or PLAB before this exam? No, you don't need any MRCP or uh, PLAB exam before this part one. Yes, if you are a trainee in UK, if you are a hematology trainee in UK, then you would need these things, MRCP or the FRCPath exam, MRCP or the PLAB exam to appear in FRCP. But if you are overseas candidate, you do not need MRCP or PLAB for your FRCPath examination. These things give you GMC license. If you have done MRCP, if you have done PLAB exams, you have GMC license then, and then you can work in UK as a doctor. If you are done both with part one FRC path and part two FRC path, this will give you GMC license as well. Okay, for part one, you do not need to work in UK. You do not need MRCP. You do not need PLAB. You can appear without MRCP and PLAB in FRC part one exam and part two exam if you are not working in UK. There is no specific timing for entry to the examination. This means that if you are hematology resident, if you are hematology consultant, if you are hematology head of department, or if you are a professori, you can appear in the part one exam anytime from anywhere in the world. Okay, but you need a signature of anyone. It should be either a consultant who is involved in your recent training, or it should be your supervisor, or it should be your head of department who can sign a form for you so that you can show it to RCPA that there is someone who says that yes, you can appear in this exam. You need only one page form to be signed by someone to be eligible for appearance in part one exam. You can appear anytime in exam, any age, any level of experience. Right. It is very important that the candidates do not sit the examination too early before they have acquired the necessary clinical and laboratory experience. This is for the hematology trainee or resident anywhere in the world. If they want to appear in part one exam, make sure you have some clinical exposure and lab exposure before you sit in part one exam. For trainees, trainees will normally require 2 years experience of specialty training in hematology to achieve the standard required to pass part one examination. This is for UK hematology trainees. Okay, this is a suggestion by RCPA, not mandatory. Many of us in UK have appeared in the Part 1 exam in the beginning of ST4. ST4 means year 2 of the training, and we have passed the exam. So if your supervisor is happy that this candidate, this hematology trainee has enough knowledge to appear in Part 1 exam, you can appear after 1 year of your training. Okay. So this is just a suggestion by RCPath, not mandatory. So you will always sit with your supervisor and say, I want to appear in the exam. Do you agree? If he or she agree, they will sign it for you. Okay. If anybody is waiting in the uh, gallery or in the waiting area, please admit them to the session. Then again, for non-trainees or overseas candidates, they should obtain the guidance from their supervisor and head of department as to when to sit for the exam, because they will be the one who will sign their form. For the Part 2 examination, it is anticipated that most trainees will complete the Part 2 examination after 3 years of specialty training in hematology. Again, this is suggestion by RCPath. It's not mandatory. If your supervisor say yes, you can go for Part 2 exam, you can appear in Part 2 exam in ST5. Okay. In year 3 of your training, it is not mandatory that you should have completed 3 years of experience in hematology, then you can appear in Part 2. No. If your supervisor is happy, you can appear after 6 months. You have done Part 1 in autumn 2025. So your supervisor is happy, you can appear in Part 2 in spring 2026. Okay. So this is again suggestion candidates may not sit the Part 2 examination until 12 months after successfully completing Part 1. This is suggestion. If your supervisor says yes, you are okay, you have enough experience, you have enough knowledge, you can go for Part 2 exam after 6 months as well. Yeah. But for the trainees, this is the recommendation by the RCPath that you should appear in Part 1 exam, in Part 2 exam after 1 year of your Part 1. Again, for the overseas candidate, if your supervisor and head of departments are happy, go for the Part 2 exam. What form do you need to sign from your supervisor or head of department? This is the form. This is a one-page form that you need to complete from your supervisor when you are applying for the exam, Part 1 exam or Part 2 exam, same form. Okay. So this says that who sponsors are the one who will sign your form. So who can that person be? A fellow of the college who have done FRCPath. He can be or she can be the sponsor who can sign your form. If the FRCPath fellow may not be present everywhere in the world, so your head of department, he may not be FRCPath, but he is head of hematology department in your country. Okay, he can sign your form. Or any hematology consultant who is not a fellow of the Royal College, but he is or she is involved in your training. For example, if I am the hematology trainee or consultant in Sri Lanka, I can ask my supervisor, consultant, or head of department to please sign this form for me. He is not a fellow of college, but he is involved in my training, or he is my head of department. He can sign the form for me. Okay. How do you fill this form? So this is the um, form that you fill. I hereby recommend your name, you are the candidate. For example, James Wilson, to be admitted to FRCPath Part 1 exam. Or if you are applying for Part 2, you say FRCPath Part 2 exam. This is my first attempt, second attempt, third attempt, or fourth attempt, you will serve. Signature of your sponsor, who is your consultant or head of department or fellow of college who is signing this form for you. the sponsor name, date, and the appointment and name of the hospital. FRCPath Part 1 exam or Part 2 exam. Okay. If you are working in any hospital, you can write your name here. All India Medical Sciences, AIMS Hospital, you can write here. If you are working there, you can write HMC here if you are working in Qatar, in Ahmad Medical Complex. Okay. Sheikh Khalifa Hospitals, if you are working in Saudi Arabia or in UAE, or if you are working in UK, write your NHS Trust name here. So this is the form that you need to copy from here when you are appearing in the Part 1 exam and when you are applying for the Part 1 exam. Where to find this form? Okay. So I assume you must be familiar with the RCPath website. If not, I will show it to you. This is Google. Just write RCPath, okay, and Royal College of Pathologists. If you have no account, you need to make an account for your RCPath. It says log into my RCPath. If you do not have any account, you can make an account here. Okay, within a day, your account will be made. Okay. Then log in. Search the website. This is the searching area, and just write sponsor form for the exam candidates, Word version or PDF version, whichever you want. Okay, so it it has appeared here. So whatever um, your name is, okay, write it here. It's not allowing me to write anything here. And then first, your sponsor signature, your name in capital, date, FRCPath Part 1 or Part 2, and your hospital. Right. Now about the application opening and dates. Everything is available on this website. This is for spring 2026. It says clearly here, application will open Friday 28th of November 2025, close on Friday 2nd of January. So if you are planning for spring 2026, prepare your application from now, which means that you need to talk to any of your consultant or head of department that we want to appear in one exam. Please sign this form for us. Make an account, which will happen in 24 hours. And then this form, sign it from your consultant. When the application opens, apply it, we will show it to you now. If any circumstances, if your circumstances changes, for example, you are going to marry, or if you have a delivery coming up, or engagement, or you are applying, or any accident happened, you can withdraw your application anytime, but ideally it should be before Friday 16th of January. With a reason, they will refund you everything. The examination period will be from Monday 23rd of March to Friday 1st May. The hematology exam is only 1 day exam, Part 1 exam. They have given you a range here because um, because there are many FRCPath exams happening. Biochemistry, clinical science, transfusion science, many FRCPath are happening from 23rd of March till Friday 1st of May. Our exam, FRCPath Part 1 exam, is usually last week of the March or September. It will be 24th of March or 25th of March. And they have mentioned you results will be issued on 22nd of May 2026. So now, how to apply for the exam? Just write RCPath in the Google. Okay? Log into my RCPath. You have to have your account. If you do not have an account, please make an account here. Okay? This account will be created within 24 hours. Okay? Then write your stuff here. And then trainees section. go to examination, okay, and then select hematology. Please do not select hematology clinical science. Many candidates have made this mistake last time that they selected clinical science instead of hematology. Clinical science is for uh, biomedical scientists. They are not for clinical hematologists or clinical pathologists. Okay. So if you have a medical degree, MD or MBBS degree, you are seeing patients, then hematology is the exam that you need to appear in. If you are not seeing patient, you have no medical college degree, and you are working in the lab only, then it's hematology clinical science, FRCPath. All these different departments has FRCPath exams in UK. That's why they mentioned that the exam period is from Monday 23rd of March to Friday 1st of March. So that's why I have circled here that you need to select hematology for your FRCPath exam. Hematology, and then apply and pay online. You can only apply after 28th of November when the dates gets open. And examination results are here. If you go to the website again, so this is the home. Okay? Write RCPath in the Google, Royal College of Pathologists. I have already logged into my account. Then trainees area, go to examinations. Examinations by specialty. You have hematology here. There are a lot of FRCPath happening for all these departments. Some people prefer transfusion science, but they are working in transfusion lab. Some people are in the biomedical scientist department. They are only lab people. They have to do hematology clinical science. Our department is clinical hematology. Okay? So part one, part two, then examination dates and news. Okay. Autumn 2025 has happened. Click 2026. Okay. So there says that application will open on Friday 28th of November. Okay. Close on Friday 2nd of January 2026. The examination period is 23rd of March to Friday 1st of May, because all these examinations are happening during this period. Some of the specialties, they have already posted their um, dates. Our hematology part one will be posted later, right? And the results, when you click on the examination result, these results are here. These results are for spring 2025. When you click it, you just see your number. They will say pass and fail, whichever roll number. Right. This is our FRCPath group. This is the WhatsApp group. This is group B because group A is full. There is no space over there. If you are not a part of the group, scan this barcode and be a part of our group. We discuss MCQs, we discuss topics, we add updates, candidates have questions, etc. You will be remain updated about FRCPath UK. How to prepare for the exam? First thing is make a firm decision. It, it depends on you. Okay? If you have made a decision that I have to appear in spring 2026 or in autumn 2026, then we can force you to prepare for the exam and get ready for the exam. If you are 50-50 and you are not regular in preparing your group, then it's unlikely that you will be ready for any exam. Okay. So you have to make your mind. You have to decide that I am going for this exam. Once you make a decision that I'm going for this exam, okay, make a small study group, 3 people or 4 people maximum. Okay, those people who are committed and who have decided like you that we will be going for the coming exam. Because if any of the candidate or the rest of your colleagues says that we will go for autumn 2025, they will not be much interested in a study as you are. So make a group with the people who are going for the exam as you are going for the exam. So choose your study buddy wisely. Right? Our admin is posting daily MCQs almost daily MCQs. He is posting in the WhatsApp group, on the Facebook group, on the Twitter sometime, and LinkedIn sometime, um, for your practice. These MCQs are made by him from the recommendations of the guideline. Okay? So if you are attempting these MCQs, you will not miss any uh, hematology updates or guidelines, because he studied the recommendations in the guideline, in the BSH, in the NHS BT, in the practical hemostasis, and then make an MCQs from that. He is, I think, at MCQ 240, and his target is to cover whole hematology in 1500 MCQs. Okay, so he's posting daily. So by the end of few months time, he will have a whole log of MCQs. These MCQs are not separate from the subscription. If you have the website subscription, the Hematomorph website subscription, you can listen to the previous recording, you can attend the live sessions, you can see the MCQs as well. Okay, you have enough stuff under the subscription. Weekly essays, some of the candidate they say that okay, when 1 month is remaining from for the exam, I will start essay practice. No, if you start essay practice from now for your spring 2026, by the end of February or by the end of March, you will be perfect in your essays. Because these essays are online, majority of the candidates from overseas especially um, will not have that much practice of typing. So you will have enough typing practice. If you have typed yourself, you will know what is important, what to mention, and what not to mention in the essay. Because all of you have knowledge of hematology. Majority of you are the hematology consultants. Some of you are head of departments. Few of you are the professors. You have enough knowledge of hematology. This exam is about skill of attempting the exam as well. Many brilliant people fail this exam because they don't know how to attempt it. Okay? But many average candidates, they pass the exam because they know that um, what the examiner wants, and they just mention those things in their essay, and they pass the exam in first attempt. In the spring 2024, we had a candidate from UAE who is acute medicine consultant, but he has interest in the hematology. He is not a hematology resident. He is not a hematology consultant. He just stick to us for 6 months, and then he passed the exam in first attempt. Yeah. This is a big example for you guys. You may be head of department. You may be professor of the hematology, but if you don't know how to attempt this exam, you cannot pass. Secondly, you do not need UK experience for FRCPath Part 1 or Part 2. This is a common question. Should we come to UK to have some experience, then appear in FRCPath Part 1 and Majority ask, should we have some experience in UK? Then we appear in part 2 exam. No. If if you think that if you have a UK exposure, then you will pass the exam, then the UK candidates, so why the UK candidates are failing exam multiple times? Okay, so UK exposure is not mandatory for your FRCPath exam. You should know what is the NHS structure, what they want to ask, how to attempt the essays, what is important to mention, how to mention, then you can pass your exam without coming to UK as well. There are many candidates. I have given you the example of a non-hematology consultant who had just interest in hematology and he passed the FRCPath exam in first attempt. So you need to know only what is important and what are the things that the FRCPath wants you in your essay. And that will come in practice. There are many sessions about that, which is already recorded and it is on the website. If you are practicing essays daily or if you are in a group, you will be updated about these things. And once you start with us from now, or those who have started with us from September, you will see they will be very, very ready for the part 1 exam in spring 2026. We conduct mock exams as well, just like the real exam. We give feedback, individual feedback to everyone, even if you pass or fail, to tell you which area is weak. We have 2-day crash courses as well for the hematology. We can only accommodate 20 people, not more than that. And then people become too much and we cannot complete the course in time. And you have recorded sessions as well, many sessions about part 1, the whole 4 subspecialties: transfusion, coagulation, oncology, hematology, emergencies are there. Um, things which make you fail the exam, things which make you pass the exam. Mnemonics are there as well for your part 1 exam and part 2 exam. A lot of stuff are there. You can go through them and we are sure that you will pass it in the first attempt. We have very good results from Hematomorph, okay, because um, you are practicing, you invest your money, and we have given you the platform to practice weekly and MCQs daily, and ask you request you to ask us a question if you have any. We stick with you till the day of exam. Okay, those who are new in the group, they can ask from the previous candidate. We stick with you till the day of your exam. Okay. This is the website, hematomorph.com. Previously, we were on YouTube. Then in some countries, they could not access the YouTube membership. Then we have to make the Hematomorph. Unfortunately, people in Libya and Kuwait, they cannot open the website. Why they can't open the website? It's their government policies. We have no idea about that. So this is our website, hematomorph.com. Okay, click menu. When you click the menu, you have plans and pricing, subscription videos, and blog. These 3 things are important for you. When you click the plans, it's a separate section for part 1 and separate section for part 2. Okay, both are at the same value. And if you have any subscription, they will give you a logout option here. Log out, log in from here. If you have a subscription already with this email, it will mention over here. Then when you click the subscription videos, all the videos are here for the part 1. These are our recent sessions on 8th of November, 1st of November, 25th of October. And when you go back every week, every Saturday, there is a session. For autumn 2025, we had 26 sessions. All the sessions are present on this website. Just click menu, go to subscription videos. All the videos are present over there. We have not removed them. Some of you may be very active and they want to listen the sessions in advance. The questions are a bit different because we modify the question every time so that there is no repetition. If we have to make repetitions, candidate would listen to the session or copy the answer from the previous one. So we try to modify the questions according to the new requirements. Previously, we used to do two essays in each session, but um, we have realized that many new things have come into hematology and the number of topics have increased. So we are now doing 3 essays in each session to cover everything, even transplant, CAR-T, and bispecifics as well. When you click the blog section, menu, blog, post, you will see all the MCQs over there. Okay. And the other one is the admin of the website and all these things. And he posts the answers in the comment section. So if you this is for part two section. This is part one section, and this is the MCQs. So he will post the answer in the comment section here. These are the ones whose answer are there. This is hemostasis question, and then the correct answer is here. Correct answer in red, osteoporosis, and he has mentioned the link as well from where you need to read about this one. Most of you would not be able to see the MCQs because these MCQs are under subscription. Which MCQ need to be under subscription is decided by Advan. I do not have any role in these things. I only teach FRCPath Part 1 and Part 2. The admin stuff is by Advan. Why to select Hematomorph? We practice with you daily MCQs. We have Saturday session for Part 1 and Sunday session for Part 2. Every fourth session on Sunday for Part 2 is a morphology, which is open to all. Anyone can join that. All the previous sessions are recorded and they are present in the website. We conduct mock exams with you and give you individual feedback. We have crash courses for you as well. You can message us. Uh, you can call us anytime. Also, we are slow in replying, but we do reply because we have our clinics and job as well, and there is some time difference as well. If someone from Singapore is messaging me, um, it will be morning time over there, and it will be night time over here. So expect a delay in replying to your message, but we do reply to your messages. If you have any question, you can ask. You can message us privately. We can help you. Okay. You can message me anytime. You can message Advan anytime. We are the two admins and of the this teaching group, and we have a WhatsApp group for you as well to ask any question from us. So now is the time for your question. How to attempt the essays and how to prepare, what topic are important for MCQs, they have been discussed in a separate session, which is uploaded um, in the website already. So planning FRCPath Hematology Part 1 exam, it's here. It has all the things, how you need to prepare for essay, how to attempt the essay, what things you need to avoid, what is important in mentioning in your essay. Everything is present in this session. Okay. And these are the, you can see these are from September, August, and August sessions every Sunday. They are for the autumn 2025, which we have done with the colleagues. Failing to act is failing the exam. Team emergencies efforts for an important session for the part one people. Candidate asked us about the algorithm for one Libran, so we mentioned over there. Okay. Common mistake session is uploaded over here. So if you have listened to this session, you will not make these mistakes and you can pass your exam in first attempt. And yes, and there is another session as well, which is last minute advice. It was an open session for everyone. It is present in the website and in the channel as well. And the mock discussion session is present in these videos as well. Right. So now, if you have any question, please ask. Right. Is there any requirement for supervisor who is eligible to sign for these part 1 and part 2 exam? Should he be from UK? No, he should not be from UK. I'm asking for overseas. For example, if you are working in the Malaysia and the consultant is your supervisor, he can sign the form for you. It is not necessary for him or her to be a UK trained. It is not necessary for him or her to have FRCPath degree. If he is your consultant and involved in your training and he is having a local hematology degree, he can still sign the form because he is your supervisor. He is involved in your training. Is there any short book recommendation for clinical hematology? We do not recommend hematology book for FRCPath Part 1. We always recommend um, guidelines, online guidelines for hematology, because if you print a book now, for example, after 6 months, there will be many guidelines which would have been updated or changes would have been made in the treatment or algorithms, or new treatment would have come, or the previous one would have been deleted. So you are left with the old guideline. And this can affect your exam if you mention the old stuff. Okay, so we always ask you to read the online stuff. If you are in the group, you would know because someone will post the new updates in the diseases. For example, CLL, myeloma, DLBCL. These are the three main things in UK which has a lot of trials going on, and every 6 months something is either out or something is either added to the treatment. If you have, for example, Hofbrand from the last year or the 2 years before, they would not mention any bispecific for lymphoma or for myeloma, etc. We have many bispecifics for lymphomas, and we have many bispecific for for the myeloma and DLBCL, etc. A lot of trials are going on. They would not have been mentioned in that book. Then, then I am a pathologist, no contact with patients, but I need to report hematopathology, bone marrows, leukemias, flow cytometry. Is this suitable for me? Okay. So we will guide you how to attempt these essays. You have a lot of knowledge in terms of diseases and diagnostic. It will be easy for you to pass the exam. We will teach you how to do these assays. We will tell you the clinical side of the hematology. Laboratory side, you have enough experience, so you will pass the exam very easily. Can the hematology in charge be MPhil? Um, hematologist to sign the sponsorship form. If he is in charge or head of department, he can still sign the form. There is no criteria that he should be MPhil or PhD or anything else. If he is your in charge, if he is the head of department, he can still sign. He just need to write his name is ABC, sign, name, and then head of department or head of hematology or head of the uh, hematology service. Okay, it will still be accepted. Like we are not treating patients, we only diagnose hematology disorders from the clinician to treat the patients. In the last two batches, which I prepared for the FRCPath exam, there are a lot of hematopathologists from Gulf countries and Egypt, and majority of them passed their exam in first attempt. Okay, because they practice the assays with us every week, and they were good in the laboratory side, better than us, better than me, and I learned from them, and they learned from me the clinical side, and they passed the exam. How to subscribe? Hematomorph or many packages or common package for part one. As I have shown you, this is the website hematomorph.com. Menu, plans, and the pricing. Part one is for you. Okay. Then you can access all the stuff for the part one, which is previous recordings. You will receive an email on the Saturday morning for the session. For example, those who have the membership, they will receive an email tomorrow morning with a link to join the part one session. Tomorrow we have transfusion session in the part one exam course. And you can attempt the MCQs and see their answers later on as well. Then is the supervisor required to affix his official stamp or submit verification of his job title? If he has the stamp with him or her, that is fine. If there is no stamp, it is not mandatory. He can still sign. He can write um, his local license number. For example, if he is working in Egypt, then Egypt must have a licensing body. Okay? He can write the Egyptian licensing body number, just like we have GMC license. We can write our GMC license. They have to write their own license number. If I'm working alone in the lab for years without hematology consultant in Saudi Arabia in a small hospital, can the hospital director sign the recommendation even if he is not hematologist? If you do not have anyone um high in rank in your department, then it is your hospital director who can sign for you because he will write head of hospital, head of hematology department. He is the head of all the department in your hospital, so he can still sign it. I am clinical pathologist, 7 years ex-holding medical MD clinical hematopathology degree, but working as clinical pathology and laboratory in Gulf. How difficult? My supervisor is not hematology, but I can find any professor to sign for me, but out of my facility is acceptable. Ideally, it should be the consultant who is involved in your training. So you are out of this stage because you have 7 year experience and there is no consultant in your lab. Your head of pathology department can sign the form for you. If you are working in a clinical pathology lab, in a lab, that lab must have a head of the laboratory. He or she can the sign the form for you. Because you are hematopathologist, I assume your head of laboratory will be hematopathologist as well. If not, you can you can still use his stamp and signature to apply for the part one exam. But you mentioned, but I can find any professor. You can find professor, but he or she will not be involved in your training. He or she will not be present in your hospital. So so the RC path may not accept this. FRC path part 1 plus GMC registration facilitate job in UK? Yes. If you have GMC registration, you can work in UK. It means that you have done either lab or the MRCP. You have GMC license, you can work. There is no issue with that. Some of the people, they come to UK on the basis of their hematology experience. Okay. Um, and they start working in UK as a locum consultant. Right? There were two consultants with whom I prepared my FRC path. They had done lab exams. They had a GMC license. They were working as uh, locum consultants based on their experience. During consultant job, they did part one, they did part two exams. Okay. As I'm a consultant pathologist from India with less minimum knowledge regarding treatment part, are there any websites or any particular sites should I concentrate to improve my clinical knowledge? Stick to BSH guidelines. They have many algorithms, many tables, and everything that you want to know about the treatment. Okay. And Hemebase is the website which has the summary form of all the guidelines. I assume all of you would know what is Hemebase. Okay. So you just write Hemebase in the Google, you will find everything. This is Hemebase. It has everything about malignant stuff, coagulation stuff, transfusion stuff, journal heme as well. Okay. For example, antiphospholipid syndrome, they would tell you where is the guideline. BSS 2024, this is the updated guideline. Okay. They have the transfusion guidelines as well, but transfusion has another section for guideline, which is called NHSBT. Just write NHSBT in the Google, it will appear here. Red cell transfusion and red cell immunohematology, platelet white cell transfusion and histocompatibility and immunogenetics. Okay, only these are the guidelines. There is another very helpful book for transfusion, which is called NHSBT Essential. Okay, and it has a lot of colorful um, pictures and stuff. This is only, I think, 60 pages book. Patient blood management is there, hemorrhages there, very nice tables, etc. Everything is uh, given over there. Right. So then, uh, her transfusion component is difficult. Any suggestion for learning UK transfusion practice? I have shown you uh, that you have BSH guidelines. If BSH guidelines are there, okay. If you go to the BSH guidelines and click the transfusion section, the guideline section, it will tell you all the guidelines which are present. All the transfusion guidelines are here. Okay. Second one is NHSBT guidelines. Okay. And the summary form is present in this booklet as well, which is called Blood Essential. Okay. And another thing about transfusion is a reference called JPAC. This is the JPAC as well, where we find our references for transfusion. Then you have question about when application open for autumn 2026. I'm afraid to lose the chance because of supervisor obstructed issue. So usually uh, the application the examination area new examination news and dates autumn 2025. So this is for autumn 2025. These applications opened on Friday 30th of May and Friday 4th July. So for 2026, expect that these applications will open on the same dates. Okay. 22nd of May will be the spring 2026 result. Then Friday 30th of May, they will open the application for 2026 as well. Okay. So these are for 2025. So assume the same date in autumn 2026 as well. And kindly repeat name of the transfusion book. I will show it to you. Okay. This is called Blood Essential. Just write in the Google Blood Essential. It will appear here. Blood Essential NHSBT. It should appear over there. Then you asked about any mock online exam practice to avoid technical and typing errors and to practice. Yes. Okay. Last time we had an exam in 6th of September, and previously we had an exam on in March. This time our exam is on which day? I will open the website. It is mentioned over there somewhere. This one, part one mock exam 2026. It is on 10th of January, and the registration link is here as well. It is present on the website. Then uh, the course is in December 20th and 21st of December, and the link is there as well. It is a 2-day crash course. We have kept very minimum fee for you as compared to the other courses in UK. They're very expensive. You can check yourself. We have kept a small amount for you. It's not very big amount. Then you asked about this thing. What about spring 2026 exam? So spring 2026 exam application will open this month. Okay. So application will open on Friday 28th of November 2025. Okay. If you are part of our part one group, we will be posting it there that the application has opened. Okay. And we will post the PDF and the Word form of the sponsorship form as well. But you should make an account for your RCPath. Okay. And then it is clearly mentioned here that you can withdraw your application on Friday 16th, and your examination will likely be in 25th of 24th or 25th of March 2026. And then your result will be on Friday. Result is always on Friday. This time the result is on Friday 21 or 22. We will check that. Examination result will be confirmed by 5 p.m. on Thursday, 31st of July. Okay? So on Thursday, 31st, everyone should receive some form of their result. Sorry, this is something else. A result will be issued on Friday, 21st of November. Here, this one. And then on Saturday, 22nd of November, we usually keep a session for you guys as well, which is an open session for everyone, where the past candidates share their experience with you guys. Unfortunately, there were some technical errors in the exam this time. It will affect the outcome. Majority of the people uh, have withdrawn their exam, and people are nervous about their result as well because the technical issues this time. But last time we had a very good percentage, or very high number of candidates who passed the exam, maybe 27 or 28 people who announced that they have passed the exam in the group. But as I mentioned, there are head of departments, professors, high level consultants from different countries who are in this group or prepare the exam, and their students are in the group as well. So they mentioned we do not want to um, message in the group that we have passed the exam. So the actual number was very high, more than 30 of those people who announced in the group that they have passed the exam for 27 people. Right, and then how much is how much time is roughly needed for part one preparation from scratch? It depends on your circumstances. If you are alone, it means you have a lot of time for your study. If you have a partner or a husband or wife, obviously your time will reduce. If you have kids, the time will reduce further. If you have grandkids, then very little time. But it depends on your experience. If you have a lot of clinical experience and knowledge, you just need few months to adopt to the UK style of examination, what things are important. You need to attend our weekly sessions or listen to our weekly sessions, and the daily MCQs as well. Okay. When I was ST3, which means year one trainee, I took 6 months to appear in the part one exam. So um, I had very little exposure for the hematology, no exposure at all during my first year of hematology training. I just spent 6 months in getting ready for the exam. So if you start from now and you have some hematology experience, you should be ready for spring exam. Okay, we will be having mock exams as well with you, and we will tell you whether you are okay for the exam or not. This time we are keeping mock exam early, one in January and another one will be in March, to prepare the candidate for the exam. They will know where are the deficiencies, so they will work on that and they will be ready for the March exam. What is the passing percentage in MCQ paper? It is different every time. Okay, sometime it is 68%, sometime it is 66%. When I appeared in part one exam in 2023, the passing percentage in MCQ was 66%. The exam after that had a passing percentage for MCQ was 68%. I remember those figures because many of the colleagues with me who failed, they appear in part one and again in autumn, and they fail again by single percent. So it is different every time. Sometimes it's 65, sometimes 69, 67. It is different, but it is always in 60s or rarely in 70. Which one is easier, MCQs or essay? General perception is that MCQs are easy. but it does not mean that you should give less time to MCQs. Okay? You should be giving the same time to the MCQ as well. Okay, because the candidate, those who fail in the spring 2025 exam, um, they fail in the MCQs, unfortunately, not in essay. Essay is considered harder because you need a technique for the essay, but it does not mean that you should not practice MCQ at all or leave MCQ to the end. That's why we are posting MCQ every day, 2 or 3 MCQ every day, so that you are in touch with the MCQs. Is it for MCQs, Path Bank or Blood Academy? If I have to choose one, personally, I did Path Bank, but we are trying to develop our own bank, which will which we are posting in the MCQs. Hopefully, in a few months' time, you will not need any Blood Academy or Path Bank. Our MCQs will be enough. We are aiming for 1,500 MCQs to cover everything in the hematology, from clinical to lab. Is it advisable to prepare for FRCPath Part 1 exam while preparing for FCPS 2 exam? Like, can their prep go adjacent? I do not know anything about FCPS. I have no experience of FCPS. Um, I have no experience of hematology in any other country, so I cannot comment on that. FRCPath is a UK exam. You need to attempt the exam according to the UK guidelines. FCPS exam may have their own guidelines. So be um, be mindful that if you are appearing in FRCPath exam, you have to read UK guidelines. What percentage of candidates pass the exam every time? The percentage level numbers are given on the FRCPath website. It also varies, sometimes 52%, sometimes 58%, sometimes 60%, but the numbers and figures, they are given on the RCPath website. MCQ is best answer? Yes. After we pass both exams, we get a board certification from RCPath, this is recognized to practice as a consultant overseas internationally. All countries recognize this credential. Yes, people get FRCPath um, examination, both the examination done, and then they can write with them FRCPath hematology, and you can work outside. Everyone here plan to get CCT, or CCT can be done only after you have done the FRCPath and go to Australia, Canada, New Zealand, and Gulf countries and practice over there. So if you have done FRCPath, you have good chances for getting a job in any country. Then after passing FRCPath Part 1, can we work in UK? Yes, you can work in UK, but you need a license. Okay? And for license, you have 3 options: either PLAB or MRCP or FRCPath Part 1, Part 2 examination. Both you have done. There is a um, there is a few posts now where the candidates the gets a job on the hospital sponsorship without GMC license as well. They give them specific time frame to get GMC license within this time. I have little idea about that, but I know a few people who is working in UK as hematologists, and they had no GMC license. The hospital sponsored their GMC license, but I will ask about it. Which date FRC Part 1 Heme Spring 2026 will be expected? 23, 24, 25, as much as FRC Part exams will start from 23rd March. The expected date is Tuesday, and the Tuesday is March 24. Is this session recorded? Yes, this session is being recorded and it will be uploaded to the YouTube for everyone. Anything else you would like to listen or ask or any other question? If no, then thank you very much. And this session will be uploaded in the YouTube, and you can listen to it. You can forward to your colleagues and those people who are in the uh, part one group already. Uh, that is fine. And those who want to join our WhatsApp group, I will post the link here. This is the link of Group B. So if you are in Group A, please do not join Group B. Okay. All right. Thank everyone, and see you next time.